what about that great, I'm going to say it, lie that is said to women about your body can go back like that once you've had a baby, because magazines tell you it's the case. Absolutely, well, it's nonsense. Your body changes as you get older. And of course, we're not just talking about your tummy, we're talking about down below too. All sorts of things happen to you as a woman, encapsulated perhaps in the basic precept of before you have a child, you wear a bikini. After you have a child, you wear a swimsuit. Well, Emma Soos knows all about this because she's gone through it herself, and she set up a number of clinics to go through this with other women. Emma, good morning to you. Welcome to the programme.
Good morning, John.
Thank you for joining me this morning. A former nurse in the NHS.
Well, I'm still a registered nurse. I just don't work for the NHS now. But mainly private.
I have to ask you, bearing in mind what the story is today, with nurses leaving the NHS, or indeed EU nurses not coming back to the NHS, you're opening a clinic up here in Bristol. Is the NHS, from your colleagues, are we heading to a bit of a problem with nurses?
I don't know it's necessarily a problem with nurses. I think service provision and the expectation of patients for what they would like to receive from their healthcare providers is adapting and changing. Attitudes towards health particularly, and patients are coming to us much more well informed.
And that, I think, is part of one of the reasons you set up these women health clinics, and I know you've got the one opening up in Bristol, is that we are well informed, but we're perhaps not as informed as we should be, especially when it comes to those three principal stages of a woman's life: before having a baby, during having a baby, and after having a baby. Because that's the sort of the big moment for a woman, isn't it?
Well, this is it. Women constantly transition physically and mentally. You know, we go from being a young woman to being a wife and a mother, and then we progress to our older years. And actually, we're living a lot longer now. We're expecting to have a better quality of life. And easy access to services at times where we're not quite sure what's going on in our bodies for all sorts of reasons.
Now, one of the interesting things, and I've been doing a bit of reading on this, and as I mentioned, we did a conversation on this programme only last week about the menopause specifically, is that's not talked about. It's sort of, it's called the change and hot flushes, and everyone goes, they don't want to talk about it. And it's not just a woman's problem, it's a relationship problem. It needs to be talked about so everyone understands what's going on.
Very much so.
And the other one, of course, Emma, is what happens when you have a baby.
Well, it's a different kettle of fish altogether.
Well, tell me about you. Be honest with me, Emma. I'm a dad of 4, so I've experienced this from the other side.
Yeah.
But what happened to your body when you had a baby?
Well, nothing untoward that doesn't happen to many, many other women. I've had 2 children. My first baby was born by a cesarean.
Right.
My second baby was a normal vaginal delivery with some complications that most women will expect, with some tears and some damage afterwards. Some good support from health visitors and doctors and so on, but there were some problems that came to the surface, some difficulties in both bedroom and bathroom activities, and I sought some help. Happened to see some of the doctors that I used to work with. That's always good fun.
Yeah.
And sort of got passed from pillar to post. Gynecologist with his gynecology hat on, a urologist with his hat on. What should we do here and what should we do with that? And didn't really get an answer as to what was the best course of action, and felt very much that I was being probed quite a lot with no progress.
And you as a former nurse.
Yeah.
So you can imagine what it's like for women who don't even have the understanding that you have.
Definitely.
That they have a baby, they have it, they deliver it naturally, well, whatever the heck that actually means. But you're laughing because I've been there all 4.
Yeah.
Whatever that means, and there are consequences that aren't necessarily bad, but they can change what happens down below from going to the loo to having a meaningful and perhaps loving sexual relationship. And of course, if you don't know what to do about it, you just suffer in silence.
Well, this is it. I was very lucky in that I eventually, after much foot stomping and temper tantrums, got referred to a women's physio, and they're very few and far between, unfortunately, in the UK. Managed to get a lady that would listen to what was going on, and we sort of explored my problem within an hour. We had, rather than the 10 minutes we usually get with our doctors, and we were actually able to pinpoint what the mechanical problem I was having, which was then having the psychological effect. And actually then we were able to tailor a treatment program that sort of helped me to get where I was. That took me nearly 3 years.
3 years?
Yeah, backwards and forwards, round and round and round. And in the end, the physio ended up with a very small, quick, put me under, let all the doctors come and have a look while I was asleep and point out what the problem was.
Right.
And then we had a solution.
And that solution, was that relatively easy once you identified what that solution was?
The solution was, let's wait until it gets bad and then we'll offer you some surgery, because we don't want to operate on young women. I was only 34 at the time. And there's consequences to operating too early in somebody who is, in inverted commas, fairly functional.
Right. But you weren't, though, were you?
Potentially, yes, but psychologically,
no.
It's very, very difficult, and relationships suffer, and your own sense of self suffers a lot as well.
So you've gone through this. You've had the baby, and this will chime with women and men listening right now who have gone through this or have got children who are going through this. Yeah. That big change is the baby, and everyone goes, "I'm tired. I don't have time for this. I don't have time for that." Yeah. But actually, there may be other things going on that I just don't feel comfortable having sex. I don't want to have sex. What's down there is not what I was used to before I had the baby. Yeah. And that affects not just the woman, but the relationship, and it puts things in a different perspective. And there are solutions out there.
There are. There's solutions, and there's more than one way to get to where you need to in a journey. And I think the most important thing that we discovered with setting up our clinic is sometimes, yes, an intervention is necessary, but sometimes also actually listening to the patient and giving them the time and talking is also just as important. And as you say, quite rightly, bringing in partners wherever it's suitable, because this is a journey that lots of couples go on together.
Let's take a pause for a piece of music. Emma, stay with us. We'll have more from you and about what you're doing in Bristol. Emma Soos from the Women's Health Clinic, who's setting up her 8th clinic in Bristol. Now, how long have you been doing this, Emma?
Officially, we've been open for just short of 2 years now.
And your 8th is going to be in Bristol?
It is.
That's some growth.
It is. It's absolutely blown us away. We started out in Leicester with our first clinic, and very, very, very quickly realised that women needed what we were doing, and we've purely grown based on the need. We have patients travelling to the Leicester clinic from Bristol,
right?
And it was just, let's take the service to them. It's very quick and easy for us to set it up now. We recruit nurses from the local area as well, which helps massively. And it's just taken us by storm, but it's what the NHS should be doing in some respects, which is requesting and responding to the patient's need at the time that they have.
Now, that you touch on something there, which I think is one of the big fundamental arguments of our day, is it not? You look back at what the NHS was set up for in 1947. You look at where we are, 2017. We're looking at the 60 years of the NHS and whether it's a national health care system or whether it's a preventative system. Now, you could say when it was set up that it was designed to give people who couldn't afford access to private medical, because that's what it was, or local councils did it, access to good quality healthcare. But there's also an element, Emma, of our own responsibility as well, isn't there? That we need to be responsible for our own health, or indeed be proactive and empowered as to know what to do when things aren't quite working, as we were discussing before the Crusaders.
The majority of the women that come to us are at a loose at their end. They've tried through traditional methods to get somebody to help them. A 10-minute appointment when you're looking at things like sexuality or vaginal issues or the menopause are 10 minutes. You don't scratch the surface.
There's your problem, isn't it? Is that the GPs don't have the time. They don't
necessarily have the knowledge to be able to support that patient.
Now, is that a? I mean, you can't expect a GP to know everything, can you? Because they are the gatekeepers of the health service, but they're not. They're not gods. They can't know everything. Is that an observation that perhaps that it isn't about seeing the doctor, it's having a well-informed midwife or practice nurse who could perhaps address these things that you are having to address now, as your growth clearly indicates?
Oh, potentially. I mean, if you look at the nurses that work for us, we recruit from a wide variety of backgrounds. majority of the nurses that work for us have jobs elsewhere. So some of them are NHS midwives, some of them are practice nurses, some of them are sexual health specialists, and they all bring something to the table so that we've got a really wide variety of skills within us. So a patient may come with some symptoms and they don't quite know what they mean. So, taking your menopause example, a brain fog, I'm getting forgetful. They may be given something like an antidepressant by their GP, and actually if you dig down a little bit further in more than 10 minutes, you may find that the periods are irregular, that they're having hot sweats, that they're not able to sleep at night, and we start to have the idea that there may be something more going on.
And it's interesting you touch on that, because this is what's known in the medical trade, if I'm right, Emma, as a history, isn't it?
Yeah.
This is where you ask a series of questions, and often, you see it in, medical dramas. Oh, just go on and treat me. And you think, well, actually, no, the questions they're asking are really important, because you may be missing something that is absolutely vital to what you're being presented with.
Very much so. I mean, we were very, very forthright in the very beginning that if you were to ring the 0800 number for our company, you speak to a nurse, you don't speak to a salesperson. So initially, from the get-go, you've got a dialogue with somebody that is at the end of the phone whenever you need them. And yes, we've got the NHS helplines and things, but sometimes you just want to talk to somebody about something in real time.
And the reality is that you're setting up this business, and we're talking about a private enterprise, and I commend you on your growth. Yeah. But you, by your own admission, you're doing this on the back of a failure of an institution, not the failure, a failure of an institution that you yourself have worked for. Do you worry for the NHS that you started in as a nurse? Or is it inevitable that there will be this contraction and services like yours will be available to those who ultimately can afford it?
I think definitely. I mean, we're certainly starting to see that in the NHS, where they are outsourcing, and a lot of people say, oh, it's privatisation by stealth. And actually, some of clinics like ours, for example, we've got a huge specialist network of people, and it makes sense to refer people to specialists. Now, the strength of what we get is we're a nurse-led service, so we've got nurses from a huge variety of backgrounds. I mean, we're up to 17 nurses across the network now, and that's a lot of experience, because most of us have been qualified for 10 years and more in our field, but also we've been women. We've had children. We've been that patient as well.
And you've been very frank about what you found yourself on the inside as a nurse.
Yeah, and the NHS is evolving. It's got to evolve based on the patient's needs.
What do you think is going to happen next? Because you're seeing a growth here. You mentioned it as the women come to the end of their journey within the NHS because they're not getting the answers, which you could say is a failure of the current system. They're finding you, and your new clinic will be opening up in Bristol 8 in 2 years. Yeah. What do you think the ultimate situation will be? Do you reckon you're going to end up with a core NHS and private healthcare providers like you dealing with specific issues related to specific moments in our health journey, our life journey?
Potentially. I mean, what we don't want to do is work separately completely from the NHS. We're not saying to patients, come to us and don't go and see your gynaecologist. We want to work hand in hand with patients so that they get the best care for their treatment. We've done quite a lot of clinical research into what we're doing and the outcomes. We've done a lot of surveys with patients, and what we've picked up in that survey is that women don't feel that they're being heard. And that's the thing with the NHS side of it. They don't have a voice in terms of women's health. We've got a big push towards cancer care and cardiac care and emergency care. But although this is something that we don't get to opt out of menopause, we don't get to opt out of childbirth, but it's trying to slowly change those attitudes that women do need to be looked after at various points in their life when they're actually well.
And this is the educative process as well, isn't it? Emma, I'm very grateful for you joining me this morning. It is an interesting evolution. Maybe we need to think in new ways, as you clearly have, of how our healthcare is provided. Emma Soos, the new women's health clinic will be opening up in Bristol very soon. Or is it open now? I don't know.
It opened yesterday.
Congratulations. Congratulations. I mean, if I was a dragon, I'm in. But I'm not, so I can't be. Emma, good luck to you and all you do. Thank you for joining me this morning.
Thank you very much.
Thank you.